Okay, hello and welcome. We want to welcome Dr. Chris Rademacher. Dr. Chris Rademacher is a clinical professor at the Iowa State University Swine Extension Veterinarian in the Veterinary Diagnostic and Production Animal Medicine Department at the Iowa State University College of Veterinary Medicine. Dr. Rademacher is also Associate Director of the Iowa Pork Industry Center at Iowa State University. Dr. Rademacher received his Bachelor of Science and Doctorate of Veterinary Medicine from the University of Minnesota in 1998. Following graduation, he joined New Fashion Pork as Director of Health Services. In 2009, he joined Smithfield Foods as the Director of Production Improvement. In December 2014, he accepted the position of Swine Extension Veterinarian at Iowa State University. Help me in welcoming Dr. Rademacher. Your clicker's right there.
All right, thank you very much. So, in the time that we have remaining before we leave today, really my goal is to try to give you the highlights of a swine disease conference that we just had yesterday. So, I'm a procrastinator anyway, but I had a legit excuse in that these just all happened yesterday. So I was kind enough, the presenters were all kind enough to allow me to clip slides from them so I could share some of the highlights from them. So a little background in it. Normally we have the McKean ISU swine disease meeting in November, but the swine section's been kind of evaluating that strategy because it's usually 6 weeks after the layman conference. It's usually the first Thursday and Friday in November. Well, that's kind of right in strike season for PRRS and a lot of health instability going on. So we've been wanting to evaluate looking at a different time, and we kind of liked looking at more of a summer meeting, and we thought the process of potentially going back-to-back with Swine Day for somebody who wanted to attend both meetings might make some sense. So this year was kind of our first year to do it. We had 270 attendees, so we had a nice increase from last year. It's traditionally a veterinary meeting, but just wanted to make sure everybody aware it's really open to all attendees, including producers. This year we did a pre-conference session on Tuesday afternoon. It was kind of a PRRS management pre-conference, so I clipped a couple of slides from a presentation there. And then yesterday was the main conference, similar to kind of the Swine Day format. Normally it was a day and a half, and then everybody was together the whole time. We went to the format similar to what we saw today. We had 4 main talks in the morning. Everybody was together in Benton, and then we had 2 concurrent sessions in the afternoon. So I'm going to just kind of share some of the highlights from some of the talks, and obviously give full credit to the authors. If you got any questions, I'll attempt to answer them. Otherwise, I can help connect you to the presenters if you have more information. So one of them is Dr. Daniel Linhares, who's a clinical professor in our group and his field epi team, a very large group of graduate students working on PRRS monitoring topics. So him and his group of graduate students, they've come up with a lot of different population-based monitoring methods for PRRS. Him and his group have come up with things such as family oral fluids, processing fluids here. This is taking the tails and testicles from castration, pooling them all together, and then harvesting the fluid off of them, and then testing that for PRRS. Family oral fluids is just utilizing the hanging ropes in pigs that are due to wean, as well as the sows, and then harvesting the fluids off them, and then testing that for PRRS or other various agents. Along with now starting to look at some population monitoring using records and some precision livestock type monitoring. The newest one that one of his grad students, Isadora Machado, looked at is a thing called tongue tips. So where would you think about using tongue tips? And this was a presentation that Dr. Linhares had seen that they were doing some work in Spain from. So where would you look at it? It's another risk-based sample, so it's another tool. And really what you might want to do, look at that, is looking for PRRS circulation in the gestation herd by doing tongue tips on stillborn pigs. It's kind of practical, cheap, really time efficient. So what you're doing there is essentially you're taking all the stillborn pigs, and they've tried to do this with like umbilical cords, blood from stillborn pigs in the past, or thoracic fluid, but that's a little bit cumbersome to teach people on the farm staff to do it. So what they've been doing is just harvesting tongues from stillborn pigs. So you can see here, you just collect your stillborns, you just take kind of the last inch, you put 20 or so of those in a bag, you go ahead and freeze them, and then you thaw them right before you ship them, you kind of squeeze the fluid out, and then you go ahead and ship that fluid off. So another kind of population-based sample, you send that off, and then you go ahead and test that. So where would you use it? So like I say, we've seen a huge increase in this processing fluid. So whenever you process, you're testing pigs maybe anywhere from 3 to 7 days after birth. And what can you kind of learn from that? Well, if they're PCR positive from processing fluids, you're kind of using that as a monitoring tool to say, okay, well, am I getting my herd back to stability or not? And if they're positive for too long, then it gets to be the question is, okay, so where's that virus coming from? Am I still birthing virus, or do I have virus in my farrowing room that's being circulated by farm staff or dirty equipment or any number of lateral infection pathways? So what you could do to attempt to answer that question is you could use tongue tips from stillborn pigs to answer that question is, well, am I birthing virus or not? So if the tongue tips are positive, that would probably tell you that the virus is likely from the fact that you're still circulating the virus out in the sow herd, okay? So we're not as stable. A lot of times these are used in conjunction with herd closure and herd stabilization procedures. Now, if your tongue tips are negative, but your processing fluids are positive, then you got to kind of go back and review some of your biocontainment procedures. You're going to go back and look at what are my procedures? Am I moving pigs around, or am I, moving around with dirty processing carts, or not changing gloves, needles, things like that. And what happens if you're PCR negative on both those tongue tips and the processing fluids? Okay, so that's good. That says, okay, we're not birthing virus, and maybe we don't have any virus, at least in this early phase of farrowing. Then another one of those population sampling methods is we can go ahead and hang those oral fluids right before weaning, or hang them in the nursery shortly after arrival to tell you, hey, have I achieved stability on that farm or not, by using that family oral fluid. So just a way to use those different population sampling methods to give you some idea as you get towards the end of the stability on the sow farm, am I truly producing negative pigs? Have I reached stability or not? So that was that. Another talk, really interesting one, was from Dr. J.Q. Zhang. And this was looking at the 6 commercial modified live PRRS vaccines against the more recent PRRS 144 variant, lineage 1C variant, and looking at some efficacy work. So we know in 2020, around the fall of 2020, that became kind of the predominant variant. Had outbreaks with high sow death loss. We had high mortality, high pre-wean mortality, high post-weaning mortality. I mean, just really one of the more virulent strains that we've seen, and is kind of, at least in the upper Midwest, probably one of the more predominant strains that are currently in circulation. Dr. Zhang last year had done an experimental inoculation study of that virus along with some other viruses to kind of confirm that that one is much more severe than some of the older PRRS viruses that we had looked at. So what he wanted to do was essentially take that same challenge model, but he wanted to compare that to the 6 modified live vaccines that are commercially available. And he wanted to evaluate if there's any differences in efficacy in a various pathological and growth advantages to that. So his experimental design here, so you're going to see a bunch of graphs coming up here. So you're going to look at 7 different groups. So group 1 were the negative controls. So they weren't given anything and then challenged with this lineage 1C variant. Group 2, or what you might see is A here, group 2 was given the PrimePack PRRS vaccine and then challenged with the variant. Group 3 was given the Ingovac PRRS ATP vaccine and then challenged. Group 4 was given the Fostera PRRS MLV vaccine and then challenged. Group 5 was given the Ingovac PRRS MLV vaccine. That's probably one of the more predominant ones that are in use today. Group 6 was given the Prevacent PRRS vaccine. This is probably one of the newer ones on the market. And then Group 7 was given the PRRSGuard vaccine and then challenged. So same sort of thing, only looking at 10 pigs per group. So remember, with everything you see, you're not looking at a very big sample size. But essentially, he went ahead and he vaccinated them, and then challenged them and collected blood and looked at underneath the tissues. So that's some of the data that we'll share with you today. So what did we see with some of those? So just kind of remember here, the first box was the negative control, and then you got the 6 different vaccines there. This was the average daily gain after the challenge. So just for 14 days post-challenge here, you can see the negative controls there. And then anything here, you got the superscript. So essentially these 3 vaccines performed very similarly, and really no difference then between the negative controls on the A's and then the AB's there, were no difference between them, the negative controls or the vaccinated ones. Anorexia and lethargy scores, so that's just the observation, were the pigs up, were they eating, were they feeling good? You kind of see the negative control, and then how the different vaccine candidates here. So most of them, except for the first one, were fairly active, so maybe some measure of protection there compared to the negative controls. Mortality, so once again, you're not looking at a whole lot of pigs here. You've got the group 1's the negative control, and then here you've got the 6 different vaccines with vaccine E, or group 6, not having any mortality there. Here's just some lung and brain pathology. So you got the gross lesions there in the lungs. You got some microscope, so that's just grossly looking at them. Do they look like they've got PERS damage? So we've got pathologists who did this scoring, and they take sections of them and look them underneath the microscope. So once again, the lower bars is the less lesions, or the fewer lesions that they saw. PERS IHC scoring, so once again, the lower score means fewer PERS lesions, and then the same thing on the brain. The lower the score means less lesions that were observed. They looked at the viral load, so they quantified the amount of virus that was in the serum. And here you can see negative control was A. You had a couple of them that were different from that, and then the group 6 vaccine was actually significantly different from those 3 vaccines and from the negative control. So they had the lowest amount of viral titer, so it would appear to be more protective on that one. And then the viral load in the brain, homogenate, once again with that group 6 vaccine, also had the lowest amount of virus in the brain. This is just looking at some antibody work that was done. So this is the ELISA antibody. So that's the antibody in response to the vaccination. Doesn't really correlate at all with protection. So not really any surprising that you really don't see any differences there. You can see the dotted line here is when they were vaccinated back here. Dotted line is when they were challenged. This FFN antibody, so that is maybe a little more correlated with some protective measures. And you can see that group 6 one, that looked like it had more protection than some of those other lung lesions and growth and mortality. Looked like they did have a little bit higher of the FFN, or serum neutralizing type antibodies there. And you also see that that group there was statistically also had a higher amount of the FFN antibody against the L1C challenge as well. So in conclusion, I'll kind of let you read the slide. It's really kind of up to the veterinarian, to look at those varying degrees of protection, make those vaccine choices based on those parameters. But at least, it's kind of a first look. And granted, it's only 10 pigs. I mean, it's not a herd level type study. It's very much a lab-based study. But at least looked like there were some differences between the different vaccines and the variant 1 strain. So that was very early. I think they really just got this data summarized here in the last couple months. That was all antibody data. They're still looking at the cell-mediated responses, so that'll be coming out soon. And I would guess all that information will be coming out in a publication here in the next couple months. So kind of finishing up from a PERS standpoint, there was one study looking at ivermectin in PERS. That was one thing that people are looking at, and as we're looking for tools with these rapidly changing viruses that are very virulent, are there any tools out there that may serve as kind of a poor man's antiviral? So one of them that was evaluated was ivermectin. There's a lot of people that have looked at it. This is just some work that was actually done to look at in kind of a trial or a more challenge trial. This is done by Dr. Kim Crawford and their group at VRI. A real simple study. They just took 58-week-old pigs, so 25 pigs in each group. One group got ivermectin, the other group didn't receive anything. All the pigs were challenged once again with that same 144 variant 1C. They received 2 mils intranasally and 1 mil intramuscularly. So you can see on day 0 they were challenged, they were bled, and they were weighed. On day 1 they received a dose of ivermectin. On day 3 the ivermectin group received a second dose. Here you can see they were bled on days 1, 3, 5, 7, 10, and 14. And then at the end of day 14 the pigs were weighed, bled, they were necropsied, and then the lungs were evaluated as well. So like I said, they looked at the serum, they pulled some of the bronchial alveolar lavage fluid to look at PERS titers in the lung. They did some lung scores, had the pathologist at Iowa State to do that, and looked at average daily gain. So what did they see from a serum viremia? So the amount of virus in the blood. So not a direct quantification, but using the CT values of the PCRs as kind of a semi-quantitative method. Here you got group 1, the ivermectin group, compared to the control group that didn't receive any ivermectin. Both challenged at the same time, and you really don't see any numerical differences at all there. Lung score results, that was the one where we did see some differences between them. It did appear, at least when the pathologist did the gross pathology scoring between them, it did appear that the ivermectin group had lower percentage of damaged lungs when they looked at the lungs from a gross standpoint. Almost statistically significant at the 0.5 level. Average daily gain, this was a very severe challenge. All the pigs lost weight during the study, but no differences between the amount of weight that was lost between the two groups as measured by the p-value there. So really the conclusions there is there were no difference in the level of viremia. Ivermectin may have reduced the presence of the lung lesions. We saw maybe that there was a little bit of difference there. It would probably have been statistic if we would have had more pigs in our study, but no difference in average daily gain as well. They did make some clinical observations. It did appear in the ivermectin treated that the pigs didn't, from a body condition score standpoint, they didn't look quite as emaciated. The depression scores, once they got kind of beyond the first 6 to 8 days, they didn't appear to be as clinically depressed in the ivermectin, and the respiratory scores were lower on day 6 as well. So maybe there's something there, but from the traditional measures that we would use, it didn't really look like there was any difference between them. Dr. Main kind of gave an update on the new diagnostic lab. Here you kind of see a picture of it. This was taken as of Monday, so making good progress there. That's phase 1, so we're near completion there. It's kind of anticipated completion date will be later this year, so hoping to start processing samples in there either in December or January. And that really is going to be mostly to do sample processing, receiving animals. We'll do a little bit of pathology, histopathology, but most of the further testing will still be done back in the traditional laboratory. That's where phase 2 comes in. They were able to secure the remaining funding from the state of Iowa through some federal money that was dedicated, and the governor was a strong proponent of having Iowa State put in an RFP for this federal money. So with that, as soon as we kind of get phase 1 completed, phase 2 will begin early next year, and that will really just kind of finish it off, and then all the further testing eventually will all, then once phase 2 is finished, will move from its current location to over here, so we'll have one completely new diagnostic lab all standalone. So the other thing Dr. Main spent some time about is just talking about U.S. SHIP. So Dr. Odekoven talked a little bit about this once again, and he's talking about ASF. We're in the process here. Really, what is it? It's really kind of our first shot at taking establishing a national program for disease preparedness, and really that ASF, CSF monitors for prevention and demonstration of freedom outside of control zones, right? So in the event that we would have an ASF concursion, incursion. What the goal would be is we have all the sites that are not involved in control zones are signed up. They received their ASF, CSF monitored. They've got all the traceability standards, biosecurity standards, and testing standards met so that they can continue commerce and trade from those sites that are outside of control areas. So, and we've got producers, packers, state and federal officials, all really bought into it. So you've got a good start on that program. Now we're just in the process of, we just got to get people signed up for that. So here's a little bit of, we get questions sometimes, well, we have all these different programs. How do they work together? If we do get an outbreak of foreign animal disease, so the infected site, that's going to be taken care of by the state and federal officials using the Red Book. If you happen to be involved in that, you're going to get lots of help from the government there. If you're in a control area, so you're affected, but you're not infected, that's where AgView, Secure Pork Supply, certified swine sample collector is going to work. In order to get movement permits to move animals out of there, you're going to need to take samples. You need to have a completed Secure Pork Supply plan. So that's all part of the FAD preparation. So that's for everything that's inside a control zone. And as we mentioned before, really where U.S. ship takes place is for everybody who's not inside a control zone, right? In order to prove that we can demonstrate freedom outside a control zone, so hopefully that we can continue to do business as normal. Where are we kind of at in the U.S. SHIP program? So it really started as a pilot program in 2021. We're kind of halfway there, rapidly moving towards it being a codified USDA program. It's really been modeled after the National Poultry Improvement Program, which has been stood up for about 85 years now, I think. So we're rapidly moving towards this being a codified USDA program. So our job really now is just to get people enrolled, right? So we kind of started here. This is the adoption life cycle of anything new and different. You start out with your innovators and early adopters. We're kind of right here in the middle now, right? So we're trying to make this push. So for that to be a USDA codified program, we ideally would like to have 80%, 70 to 80% of the herds in the U.S. Signed up. So we're kind of sitting in about that midpoint right now. If we look at U.S. SHIP enrollment as of May 2023, we're at about 55% of the breeding herd and 50% of the growing herd. So we're, like I said, in the middle, halfway there. We just got to work to get the rest of the sites signed up. Here's a graphic just looking at U.S. SHIP enrollment by states as a percentage of inventory. So there are the green states there. You can see those are 60% or more. Kind of this light green color there at 40 to 60% enrolled. And you got some that are a little bit more at the beginning. The light yellow there is 20 to 40. The gold is less than 20%. So enrollment and participation is really pretty simple. You just contact your official state agency to make sure you get your state-specific forms. So this is really a national program, but everything is really controlled and mitigated at the state level. So everything's run through your official state agency. So here in Iowa, that's going to be the Iowa Department of Ag. Is going to control that. If you're from another state, if you just Google U.S. Swine Health Improvement Plan, there's a great website there that'll give you all the details, how you can find and contact information for your official state agency. It's pretty simple. You just complete your enrollment form. You submit a short biosecurity survey. That kind of gets you started. You'll eventually then start working toward pursuing certification. And it's just really kind of an acknowledgement of the existing program standards, which are all pretty simple and basic. Working towards developing and being able to show that you have 30 days of movement records and that you can send that electronically. And then stay engaged in the process, right? So enrollment part of it's really pretty simple. So that's the process we're at now. We're at 50%. We'd like to get to 70 as we're moving towards this being a codified USDA program. All right, in the time remaining, we'll just talk about a couple of interesting cases. One of the tracks that we did were a series of case studies. So I picked a couple of them that I thought were kind of interesting, things new and developing, things we haven't seen in the past. One of them was from Dr. Petznick, who's a practitioner in Nebraska. Also is pursuing a concurrent master's degree here with Dr. Linharis and his group. And he had a really interesting case study. He talked a little bit about it. It was a 4,500 head farrow to wean facility. And they kind of been battling this diarrhea for about 2 years, located kind of in northeast Nebraska. But it was kind of a nondescript diarrhea. You know, really the problem was just, wow, we just got this scour and, you know, we're not weaning as heavy pigs as we probably should. And it was pretty consistent. It would only be 7 days of age and older, kind of this, you know, tooth paste, yellowish brown. You know, it affected a fair amount of litters, but it wasn't really causing mortality and it wasn't responding to treatment. But it had been going on long enough that the owner was getting fairly frustrated. And initially you'd look at it, well, 7 days of age or older, you know, not really killing pigs, no respond to treatment. Well, maybe this is just a case of coccidia, you know, it would feel something like that. They had sent in, you know, several pigs and had tested them. You can see you test them for rotavirus, all negative. Test them for PD, porcine delta coronavirus, TG, all negative. You know, looked underneath the microscope, couldn't find any evidence of coccidia. Tried to culture all these different type of bacteria. You can see no growth, right? So they just weren't finding anything at all. So they had the ability to use one of the newer tools that we have in the diagnostic lab, which is next generation sequencing. So they essentially take a sample and they'll digest it down to the nucleotide level, and they'll go ahead and analyze it, and then they compare it against every known bacteria or virus known to man and see if there's anything that matches up. And lo and behold, he gets a call from Ganwu Li, who was our director of our next generation sequencing, and said, oh, this is very interesting. And what they found was, and usually when you do next generation sequencing, you know, you might find 10% of this virus or 10% or 5%, you know, it's usually a smattering of a little bit of everything. Well, in this one, 90% of the reads was this porcine sapovirus. So if you get one where you see that many of just one kind, that's pretty diagnostic to say that's probably what it was, because there's just that much in there. So they went ahead, developed a PCR test specifically for porcine sapovirus and tested those samples, and sure enough, they have very low CT values, which indicates a very high amount of virus. So what did they were excited that they could find that, okay, now we at least know what's causing the diarrhea. So they tried to do sanitation, environmental cleanup. They tried doing feedback and controlled exposure, and they just weren't having any success with it at all. But, you know, so the next question is, well, this is something we can vaccinate for. Well, there are no commercially available vaccines. They can't grow the virus, so they can't do a traditional killed autogenous vaccine. So they had a question about, well, what about RNA particle vaccines? Because they can create those RNA particles from sequences. Okay, so they went ahead and worked with Merck Animal Health and went ahead and created an RNA particle vaccine. They did some on-farm testing, and they saw in there, they saw a response. They saw a reduction in shedding and gilts. They saw a reduction in pre-wean mortality. The staff and herd vet observations saw almost a complete disappearance of diarrhea, and then they saw a nice increase in the amount of wean weights as well. So that was for that case. Then it gets to be the question as well. I wonder how many other farms are starting to see it. So ISU, I think we're aware we're the only diagnostic lab that has a PCR for sapovirus. So another one of Dr. Linharis' grad students working on combining information from all the diagnostic labs. So, but since ISU is the only one that has it, we started pulling information from our internal laboratory information system, and lo and behold, we're starting to see an increase in the number of cases of porcine sapovirus. So, could be an emerging disease, something to talk to your veterinarian about if you have clinical signs that are similar to that. Another emerging disease that Dr. Mike Gray, who's at North Carolina State, he was recently a pathologist here at Iowa State with us here, looking at porcine astrovirus associated with tracheitis and bronchitis in weaned pigs. And where this one gets to be really interesting is it's very common that we see this coughing at either just prior to weaning or shortly after weaning in pigs. And you kind of get this look when you open up pigs, you have this areas of coalescing atelectasis. So this is somewhat normal lung. Then you can see all this consolidated lung. I always call this like checkerboard, pattern of consolidation of the lung. And people always say, well, it's influenza because, it used to be, well, that's what we would find. But we have a lot of cases that would come in like this where, we would test them, but they would test PCR negative for influenza. And we'd be like, well, maybe we missed it. Maybe it's too late in the course of disease and we're just not finding it. So that's what normal epithelium looks like. And then normally these ones that were affected, so what you can see is you see kind of, light purple cells here while you see this aggregation of all this heavy, purple cellular lymphocytic infiltrate because you've had all this epithelium that's been denuded and lost, and the lymphocytes are in there trying to clean it up and protect it from getting into the bloodstream. So very classic bronchitis. So the one case that Dr. Ray had was, looks like influenza. They tested it. Sure enough, was PCR negative. So they just filed under bronchitis, non-specific viral. So they went ahead, again, did the next generation sequencing, although it was at a much lower level, they did find some porcine astrovirus type 4. So what they did is they built a test which is called RNAscope, which essentially is they have the ability to try to stain the genetic material specific for porcine astrovirus into these cut sections of the lung. And sure enough, just look how that lit up, okay? So it's like, okay, that's pretty definitive that that's the agent because that's very specific. The RNAscope is very specific for the disease or for that nucleic acid of interest. So it's kind of like PCR for tissues is kind of the way to go. So that was very definitive for that case. So the question came about, well, I wonder how many of these other nondescript cases where the PCR comes back negative for influenza are we finding porcine astrovirus? So they went back through the lab cases from 2019 to 2022, looked at 1,000 cases, screened them down to find 117 cases that matched that description in that age range that were influenza PCR negative, and they went ahead and put that direct detection for porcine astrovirus type 4 using the RNAscope for it, and lo and behold, 73%, so 85 of those 117 cases in those just due to wean or recently weaned pigs were positive for porcine astrovirus type 4. So, in other words, for those ones that are PCR negative and those pigs that are coughing at weaning, that certainly might be something to talk to your veterinarian about requesting a test for. Last one I wanted to, just with our time here, was some cases of anticoagulant rodenticide exposure in pigs. So this is Dr. Radke, who's our toxicologist here at the VDL. In 2022, we at the VDL had 8 cases of rodenticide exposure alone. Now, FARED, which is kind of our national database, had from 1999 to 2021 only had 23 reported in general. So it was really a high year. Majority of those cases, of course, were all market weight animals from 2 days to 2 weeks before slaughter, so right before slaughter. And some of the commonalities between those cases were they'd have a pen or two pigs that broke out of the pen. They'd gain access to the office or the storage area. And when they would come in, they found notable amounts of rodenticide that was gone. So they'd break into the pails. So anywhere from 5 to 25 pounds of rodenticide that was missing. And then in most cases, the animals were just returned to the pens. In some cases, the pens were only 35 pig pens. In some cases, they were 400 pig pens. Now, in 7 of those 8 cases, the exposed animals were returned to the pens unidentified. They didn't bother to mark the ones that they just saw the pens open and moved them all back. One of the cases, they were able to tell which pigs were exposed, and they identified and penned those separately. So it raises a problem, right? Because any of those anticoagulant rodenticides, any of that food, that meat's all going to be tainted, and that's going to be a risk for people as consumers. So it's a big problem. What animals were exposed? Could they be identified, and can they be marketed? That's really the question. That's where the VDL got involved. And there's really not much for testing, unfortunately. That can be done antemortemly. For one of the agents, there's a plasma test if you catch it within a week. You could look at, but that doesn't cover all the anticoagulants. That's only for one class of it. You could do some post-mortem at the livers, since most of these are concentrated at the livers, but I can tell you the packing plant doesn't have a whole lot of interest in harvesting them there and then holding the carcasses that maybe they'll be negative, right? What about withdrawal times? Well, it's going to depend on a lot of factors, right? The dose, the length of the exposure, which compound, what are the toxicokinetics, what's the age of the animal, and how much time you got to market, right? FARAD is that's the database that we use to try to estimate withdrawal times when there really aren't any, based on the scientific information's out there, but there's no clear cut for those. You know, there's one study done for one of them. It says 160 days. You know, they can find residues for some of these second generation ones that are out. Here you can see in the length of the weeks. So what wound up happening, right? Well, essentially, since they were unable to identify the exposed animals, the packers said, we don't want anything to do with them. So essentially, what they wound up doing was they demanded euthanasia of those entire pens of animals. Because, you know, they didn't take time to mark the ones that they thought were maybe exposed. The one case where they did, they just had them euthanize those ones, but the ones where they didn't know the exposure, they just had them euthanize the entire pens. Now, what about disposal, right? I mean, the disposal of those carcasses are important too, because you have this consideration of, well, those carcasses sometimes wind up in the, you know, animal chain, right? So the renderers, that's not going to be an option. They don't want anticoagulants and things that might wind up into dog food. And, you know, little known secret about that is in cases of, you know, food, you know, where people are, you know, starving or we have food shortages, people eat pet food, right? So rendering definitely wasn't an option. Burial would be one. Composting in some places that's okay. In other ones they weren't, or incineration. But there are definitely potential legal ramifications too. So really the whole focus of that was just to raise people's attention to say, you need to really be thinking about proper storage of pesticides. On the floor in the office or on the shelves were not acceptable, right? They should be in a locked box or kept off site. And then as always, if you're doing bait replacement, you want to put them into bait boxes. Proper bait placement is key, not up on the shelves. That thing is going to aid in avoiding these situations entirely. So with that, I think we're right at our time, but I'll be happy to take any questions on those. Yes?
Why would composting on the...
I'm not sure. I wasn't at Dr. Radke's talk, so he had told me about it. I'm not sure if it's a situation where they're worried about what happens. You know, you take the compost material, then you spread it on the fields, and if they're worried about, you know, secondary contamination that way, that would be my guess. That's why I'm guessing burial or incineration, you're not worried about scavengers or something else, you know, getting a hold of the compound secondarily. That would be my guess. Yes, Jack.
Do you have a comment on why the live virus exposure on staple virus does not work? Because as it seems to me that the mRNA is not as effective as a live virus. So, can you comment on that?
Yeah, I don't. That's probably a Dr. Petznick question. Yeah, I'm not sure. I know he mentioned, I did sit in on his talk. He just had mentioned that they didn't have very good luck with feedback. So I don't know if it was a concentration issue. You know, generally with feedback, you might pick up that baby pig scours, but usually mix it up in a bucket with a bunch of water, and then you're giving a little bit, you know, to all the sows. So maybe you just dilute out the effective amount of antigen, right? You don't give them enough. Whereas, you know, by putting it into the particle vaccine, you know, you're concentrating the amount of antigen. Maybe you're just giving them a much better response or a lot higher dose that way. That maybe could be, but I'm not sure if that's it or not. That would only be my speculation. Good question. Anybody else? Yes. Yeah, I believe that would be the transmission method and model. Yeah, that one's kind of interesting just because it looks like a lot of the other stuff that we have for Pharaoh and diarrhea, and it's not uncommon that you sit there and say, oh yeah, and the really interesting thing is a lot of times when you start surveying for rotavirus, you pick them up. And histopath lesions there, they look very indicative of rotavirus, so I wonder how often rotavirus gets blamed and it's not rotavirus at all, right? So So the fact that his case there was rotavirus negative, I thought was kind of interesting. So it made it a whole lot easier to actually diagnose it, to say, oh, it's got to be something different that we've got to sit there and take a look at. And I think the thing is to say that's something else to be thinking about if you got this complicated case and you're not sure, and it's at least one other thing to look at. But like I say, we're aware that I think Iowa State's the only diagnostic lab that's got a PCR for it right now.
So, Dr. Richard,
Yep.
what are your speculations about that, the Zika virus only appear in over the age of
7 days? Yeah, that's a good question too. I'm not sure if that's just the incubation time, how long it takes from the time that they get infected, or if there's a little bit of immunity, because obviously it wasn't, the sows were probably infected. That's probably where the piglets were getting affected from, and they have a little bit of maternal immunity. I haven't seen that they've developed an antibody test for sapovirus yet, so once we do that, we could probably answer that question. But that would be my guess, is that maybe there's enough maternal immunity there that. But the interesting thing that Dr. Petzenik did say is, it was pretty common that it was, maybe 5 days, maybe out to 8 days, but it wasn't, certainly not any younger than that. Good questions.
Okay, let us thank Dr. Rademacher one more time.